Good afternoon. Today's date is April 2nd, 2020. Today's community update on COVID-19 in Buncombe County includes updates from Dr. Jennifer Mullendor, Buncombe County Medical Director and Interim Public Health Director, Eric Barnes, the Assistant Public Health Emergency Preparedness Director. And I will follow up with some additional updates on how residents in our community can assist with additional needs. This is being live streamed on the Buncombe County Government Facebook page. The Spanish language version of this community update is being streamed live on the Buncombe County Health and Human Services Facebook page, and that handle is at BCHHS. We will start today's update with Dr. Mullendor.
Good afternoon. As of this time, Buncombe County Health and Human Services staff have been notified of a total of 31 lab-confirmed cases of COVID-19 in Buncombe County residents, including one fatality. 3 Buncombe County residents with lab-confirmed COVID-19 remain in isolation. Our nursing staff are actively interviewing 6 individuals with lab-confirmed COVID-19. And we've had several labs come in this morning. And I want people to know that these labs, many of these labs were collected a week or even more ago. So these new cases don't necessarily mean that we're seeing a spike in COVID-19 activity in our community at this moment. Our county residents with lab-confirmed COVID-19 have ranged in age from their 20s to their 80s. And we have had no new cases reported in out-of-state travelers to our county. It's important that we all understand that regardless of our income, our race, our ethnicity, our gender, our religion, or what neighborhood we live in, we are all vulnerable to becoming ill with COVID-19. This virus reminds us that we are all connected and we are all responsible for each other. It can be difficult to know how to safely care for yourself or for others when our guidance is to stay away from other people. I would say that the most important thing we can all do to prevent the spread of this infection in our community is to stay home, away from others outside of your household, as much as you are able. Additionally, it remains important that we wash our hands frequently with soap and water or use an alcohol-based hand sanitizer. And we should all be checking ourselves for symptoms of COVID-19. Specifically, check yourself for, do you feel feverish or do you have a fever? Do you have cough or difficulty breathing? At this time, we should be particularly careful if we share a household with other people, especially if we are essential employees who must leave our homes to do important work, whether that be here at the county or a fire department or a grocery store or a child care facility. I'm going to tell you what I do when I go home for the day. So while I would typically open the door and see my son and give him a big hug and a kiss, the first thing I do now is say hello and go wash my hands. And then I go change my clothes. And I put on clothes that are my household clothes that I only wear in my house. And then I go give my kid a hug and a kiss. And I give my husband a kiss. I'm trying to do my part to keep them safe. I also have disinfectant wipes, and I wipe down my cell phone, which is probably the thing I touch most during these days. So I would ask that you consider what you do when you get home from your trip to the grocery store or from your work as an essential employee. If someone you live with becomes sick, ideally they should have a bedroom and a bathroom of their own. But we know that this is not possible for everybody in our community. And so do the best with the housing situation you have. If the ill person has access to a mask, like a surgical mask, ear loop mask, they should wear that when they're around others in the household to go to the bathroom or go to the kitchen. If they don't have that type of mask, then I would recommend like a bandana or something they can wear over their face, over their mouth and nose. They should try to use the bathroom and the kitchen or other shared facilities when others aren't around. And then the kitchen and bathroom should be cleaned and disinfected after they use it. It remains critically important at this time that we avoid gatherings of people outside our immediate household. So I live in a neighborhood in Asheville, and I pay attention to what my neighbors are doing. And I would say that most people are following this guidance. I see couples out for walks. I see families walking their dogs. I don't see a lot of people congregating with people outside of their household. And so I thank you for taking this seriously and for doing everything you can to protect yourselves, those you live with, and everyone else in our community, especially those who are most vulnerable. And I know it's hard. We're social beings, we're humans. We want to get together with other people. But now is the time to be socially responsible. And again, stay home with your immediate household and reach out to others in different ways. Pick up the phone, use social media or video conferencing apps. Again, from my own experience, my son FaceTimes with his grandparents. He's building a Lego treehouse with his Nana in Polk County. He would much rather be with her, but this is the safest way that he can remain connected to his Nana. So again, I ask people to see what you can do to stay connected to people, but in a safe way, a non-physical way. And if you develop symptoms of cough, shortness of breath, or fever, which would be a temperature of 100.4 or higher, you can reach out to your medical provider. We know that many providers in our area have switched to doing telehealth with patients. So either over the phone or with video. And so take advantage of that if you feel that you need to reach out to your provider. You can call an urgent care if you feel you must be seen and are unable to be seen by your provider. And if you have no provider or don't have the means to go to an urgent care, please call our Buncombe County Health and Human Services communicable disease staff at 828-250-5300 to get guidance. Anyone who's experiencing significant shortness of breath, chest pain or pressure, significant difficulty breathing, or confusion, that would be when to call 911. It can be very hard to break habits, but it's very important that we do make changes to our normal routines during this time of COVID-19. Our ability to take these actions can make the difference. The difference for you, the difference for somebody in your household, the difference for your neighbor, or that vulnerable person in our community. Let us all work together in taking these actions. Together, we are stronger and more resilient. And during this global epidemic, our local response and actions can and will make the difference. Thank you. I'll now turn it over to Eric Barnes.
Good afternoon. I'm Eric Barnes. I'm the Assistant Public Health Emergency Preparedness Director for Buncombe County. I've been working at the Buncombe County Health Department for the past 20 years as a registered environmental health specialist. Moving forward, I will be assisting our Public Health Preparedness Director, Fletcher Tove, with these briefings. I would like to begin this afternoon by responding to some questions about our Stay Home, Stay Safe declaration. First question. People are concerned about checkpoints and being stopped to prove that they are essential employees, and is there a curfew in effect? There is no curfew. The Stay Home, Stay Safe declaration is a standing declaration effective until Thursday, April 9th. Buncombe County is not taking any actions to disrupt transit or roads. We are only asking people to limit their travel to essential travel only. At this time, essential personnel and businesses do not need any credential or a pass to be on the roads. The bottom line is that if you don't have an urgent or pressing need to be out, you need to be at home. Next question, what about in-person auto sales? What can be done about this, and how are we enforcing this? This is an area in which our local orders are more restrictive than the governor's. In-person auto sales are non-essential until April 9th. Auto dealerships can show and sell vehicles virtually, and they may close and complete paperwork and processing as long as they are adhering to physical distancing and hygiene guidance. Auto repair and maintenance are essential services. If an auto dealership has a maintenance and service line on site, that line of operations may continue to operate. Law enforcement response to violations of the statute are complaint-driven, so we pass this concern along to them. We do ask that anybody reporting a violation of the local statute do so on non-emergency lines. We don't want anyone calling 911 for these purposes. Law enforcement entities will enforce the order through education, dialogue, and seeking voluntary cooperation from all residents and businesses. If voluntary cooperation is not achieved, Buncombe County law enforcement is equipped to enforce these restrictions through citations or misdemeanor charges. Next question. Grocery stores that are not taking measures to enforce social distancing. Are we doing anything to enforce social distancing guidance? Grocery stores and basically any form of food and nutrition delivery are considered essential. We are continuing to reach out to grocery stores with our latest guidance and recommendations. We have encouraged them to consider limiting the amount of people allowed in their stores at once, as well as to mark out 6 feet intervals when people are waiting to check out. Next question, how are we enforcing Airbnb stays? Over the last few weeks, we have had many calls with local business groups to include the Asheville Independent Restaurant Association, Land of Sky, Chamber of Commerce, and Explore Asheville to push guidance and answer questions. Among these groups that we've been in communication with is the Asheville Homestay Network, which represents a large number of Airbnb and VRBOs in the area. We are currently working with them to clarify and ensure our guidance on short-term rentals under our local Stay Home, Stay Safe declaration. One final question. Despite lockdown measures, cases elsewhere have been surging through assisted care or nursing homes. What more is being done to check in with these facilities and try to prohibit spread? We are very aware of the increased risk for this type of care facilities where the entire population falls into our high-risk category. For months, we have been reaching out to them to pass the latest guidance and instruction from the CDC and Public Health. We have dispatched county fire marshals to all of these facilities to personally deliver documents and provide guidance. We constantly update our planning efforts for the quickest possible response to any indication of cases at one of these facilities. In closing today, we know that the weather will be nice over the weekend, but please do not use this as a reason for close contact with anyone outside of your household. Do not go on a raft with 6 people who are not in your household, or load up in a truck and go mountain biking with several of your friends. Get some fresh air, but don't be fooled into a false sense of security. Please continue to maintain a distance of 6 feet between yourself and others. Wash your hands and try to reduce your exposure as much as possible. Thank you.
So we also would like to let people in our community know some of the ways that they can help as individuals. So one of the questions that we are getting right now are, how can I volunteer? Or what items are needed that I can contribute to assist with the COVID-19 response? In addition to needs for personal protective equipment, there are other major needs for cleaning supplies, particularly bleach wipes, baby items, diapers for all age ranges, and baby wipes, personal care items such as shampoo, deodorant, and feminine care products, and non-perishable food items, especially canned foods with pop-tops. Please visit handsonasheville.org. That's HANDSONASHEVILLE And on that page, you will click the in-kind donations button on the COVID-19 response page. We would also like to let folks in our community know that there is a way for information on the Buncombe County webpage to be translated into many languages by using the toggle switch on the buncombecounty.gov webpage. And that toggle switch is up in the right-hand corner of the webpage. We will be back with the next community update on Monday, April 6th. And in between now and then, we will continue to notify our community of any major updates over the next couple of days using all available communication channels. Thank you and have a safe weekend.